news article about anything in digital health, it's always like paragraph 4. Like, what about privacy? Like, it's just always there. And I find it like endlessly frustrating, frankly, for a few reasons. One is, so when my wife was pregnant and we kind of went through the experience of like, all the medical appointments before my daughter was born and then when she was actually born, it was my first time having like a year where I encountered the healthcare system like every 2 weeks or every month. It was a kind of frequent interaction with the healthcare system. And I very quickly started playing this game called Spot the Piracy Violation. And if you look in the physical world and as you look around, you will see piracy violations constantly, 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 constantly. Like, sit in a hospital waiting room and just listen. You're going to hear all the stuff. Or go stand in a Shoppers or a Rexall, any pharmacy, stand near the pharmacy counter and just like hear the PHI flowing towards you. Like, you're going to hear all the stuff. No one like, does the thing you're supposed to do in the digital world, which is like make sure that no other human ever sees the data, like lock it up. We have this like really odd double standard where in the digital world, we want everything to be like perfect and like sort of locked away. And in the physical world, we're just like, whatever, people can over here. Who cares? And so like the idea that we just have this like, I don't know, it's a very strange double standard to me. But it's also, I think it kind of traces back to like legal traceability and that it's sort of hard to prove and sue someone for privacy violation when you overhear something, but it's easy when it's like, I don't know, in a database that tracks who's doing what. So that's one frustration I have. The other one is, I think if you surveyed people and asked them, do you think you should have control over who sees your data when? They would say yes, absolutely. If you surveyed them and said, do you think all your data is getting sold to big pharma? Do you think ChatGPT is using your data to train its models? They say yes. Of course that's happening. Like, people kind of assume that like, their data is being widely used. And as much as they would prefer that it not be, they're not that fussed about it. They still use TikTok and Instagram, and they still use ChatGPT for their health information. Our revealed preference of our behavior is that we care about privacy, but not that much. And in particular, we care much, much, much more about the people we know and love having that information. Like, if um, if you are worried about talking to your doctor about some condition, that condition reveals something you did you shouldn't have done, like, definitely don't want like your partner to see that. This is like a classic privacy thing. You don't care that much if like random pharma researcher sees it and like an anonymized way, like your health card number. And so I don't know. I think we have this very strange attitude towards patient privacy. It is a bit of a sacred cow in our society, but for reasons we can't quite put our finger on. Um, and yeah, I think it makes things harder, puts a chill on things. And it really, like, what we don't say to people in those surveys is, do you want to have complete control of your data if it means that your data will not be shared, will not drive health system research, will not lead to new drugs and medicines? Like, if we position that as a trade, people probably wouldn't take that trade. But we don't position it because we pretend that digital health is easy. We pretend that if you just like design everything right, privacy by design, no problem. We can just make everything work perfectly at zero cost. Which is, like, it's privacy is a really high cost and makes these systems much harder. And that's the trade. Like, I'm just one person. I don't think my opinion should be the driving factor, but I think we should be honest about the trade. I would take that trade every day. I would say my privacy is less important in various ways than health system planners and researchers and innovators having access to data. So I am okay with my data being handled a little bit loosey-goosey on the back end, as long as like the people in my immediate circle can't see it, because I want to be private, and as long as it actually drives innovation, like I'm okay with that trade. But again, I'm one person. I think it's a bigger public conversation, but I think if the trade was framed in the way it is in reality, we would be like, yeah, I guess it probably is important that life-saving vaccines and medicines be developed, and if that's what you're talking about, then sure.